It is a hectic day in the ED. One of the patients, Dan, is ready to be transferred to the ward. The ED nurse reports Dan as ready in the DNV Imatis app. The coordinator, who has a complete overview of bed availability and care needs at the hospital, sees the notification on the board and directs Dan directly to the correct ward with the right expertise and lowest acuity. The information is immediately shared with the ward manager, who assigns a nurse and a place in the ward for Dan. The nurse then receives a message about Dan and opens the transfer note in the EPR directly from the message. When he is ready, he reports Dan as ready for admission directly in the app. The ED nurse receives updated information at the same time as the porter is automatically booked. When the porter picks up Dan and marks the assignment as started, the cleaner receives an assignment to clean the vacated bed space. Dan is safely wheeled into the ward. The porter completes the assignment in the app, and the responsible nurse receives a notification that Dan has arrived. This is how we seamlessly transfer patients. It increases patient safety, shorten patient stays in the ED, and free up working time. For the benefit of both patients and healthcare personnel. Hospital flow coordinators, ward managers and teams, and even the COO can use the dashboard to get an at-a-glance view of capacity and hotspots across their areas of responsibility. The ED is no longer a bottleneck. It is the gateway to stable, safe, and cost-effective treatment. The workflow has been developed in collaboration with staff from ED and wards and is in use at numerous hospitals. The workflow is always adapted to the customer's needs. Training is simple, as the system is intuitive and easy to navigate. DNV Imatis digital solutions help hospitals around the world solve complex challenges in patient flow and resource management.